is child health. My name is Dilan Devakumar, and I'm a Professor of Global Child Health in UCL, University College London, and I'm also the convener and chair of the International Child Health Group. ICHG is a special interest group of the Royal College of Paediatrics and Child Health, and we are a collective of health professionals from around the world who are interested in working in child health. Membership is membership is open to anyone, and if you're based in a low middle income country, you can join for free as well. We have lots of things going on. The winter meeting, or depending on where you are in the world, the summer meeting is one of the main things we do, but we also run an international meeting at the RCPCH annual conference. We have webinars, we have podcasts, we have a mentorship scheme. We have 4 subgroups: advocacy, education, research, and students. And there'll be more on all of this at the end of the conference today. So please do have a look at our website, which we can put in the chat, and do sign up if you're interested and get involved. So today's conference is on climate change and child health, and I'm speaking to you from the Conference of Parties COP27 conference in Sharm el-Sheikh in Egypt. Climate change is one of, if not the most important threat to health today. But who's affected by climate change? It's children and young people. And linking to the loss and damage discussions that are happening at COP, it's the poorest children and young people from around the world, and also from minoritized groups from around the world. And as we'll find out, the effects are numerous: diarrheal infections, respiratory infections from air pollution, trauma from extreme events. What should clinicians do? Well, first and foremost, is to pick up the pieces. It's to treat those children who come to your clinics, but also to stand beside and behind them as child health advocates. And we've seen that adolescents have been at the forefront of these discussions and debates, and child health professionals, we should support them. And we need to remind ourselves that this is now the 27th COP that we're having. So these discussions have been going on for a long time, but now they're getting ever more critical every year. So thank you very much for joining the event today. We have a wonderful lineup of speakers, experts from around the world, and thank you very much to the organizing committee who put in so much work into this. First up, we have Dr. Marina, Romanello, and Professor Anthony Costello. But before that, one of the organizers, Erva Sinha, will describe some of the aspects of the platform that we're using. And then Dr. Srinivasa Ramblata will introduce our next speakers. Erva, do you want to say a few words?
Sorry, I was muted. I'm really sorry. Thank you. Thanks so much, Dilan. Hello, everyone, again. Thanks for joining us today for our winter meeting. It's such a privilege to have you all here. I hope you have you basically enjoy the whole event with the most amazing speakers today. So I'm Merva, one of the organizing committee members and co-leads of this event. So I will just give you a little bit of idea about how to use the platform, how it looks like. It will be very quick. I know you probably mostly familiar with what I'm going to tell you, because we have sent you a welcome pack. But yeah, sorry if this is going to be a little bit of repeat for you. So as you are watching us right now, you should be able to see different sections on your left-hand side of the screen. So on the top, first there is a reception section, which takes you to the main event page where you can find information about our speakers and our program. So if you need to just refer to that point to just understand where to be and when and where to be, just basically go back to the reception area throughout the event. So just under this, you should be seeing a stage section where you are currently watching us. So the keynote sessions and the plenary sessions will be happening on the stage platform. Under the stage, there's a session section. You need to go to the segment to join your workshops in the morning and afternoon. So when you are in the session, when you are in this section, you will be able to see the picture of your own session when it is start time, and you will be able to just easily join it as well. We also have a networking and people section where you will have the opportunity to meet new people during the event. You can visit the networking section anytime on the day, but we strongly encourage you to be there at the lunch time. This is the time specifically allocated for this section. So you will you basically that you should be seeing a join now button when you go there, and you should be able to just be matched with new people with basically similar interest. During the sessions, we will probably be collecting and receiving the questions at the end of the sessions. So there's going to be a comment and chat box in the sessions and in the stage section. So if you can just put your questions on the comment and chat box, we will be able to see, and hopefully our speakers will be trying to help and answer your questions. So we have got the hashtags on the reception page. If you would like to share anything, say anything about our event on your social media accounts and tag us, we will be happy to share them, repost them. We will be happy to just see what you are saying about our winter meeting. So we will always be around. If you have any questions, just drop up a message to us. Yeah, hope you will enjoy the day. And I am handing over to Shireen now for our keynote session. Thank you.
So hello, thank you very much, Eva, for the introduction. So my name is Srinivasa Rambatla. I'm a pediatric trainee in Northwest London, and myself and Professor David Kumar will be moderating the first session, and I'll just be introducing Dr. Marina Romanello and Professor Anthony Costello, who will be giving our keynote on impacts and children in all policies from child health and climate change. So Dr. Romanello unfortunately can't be with us today. She's traveling and has poor internet. So she's kindly recorded a video for us, which I'll play first. And then Prof. Costello will then follow up with some slides and then questions as well. If you do have any questions, please put them in the comment box and we will endeavor to answer them either in real time or at the end of the session when we'll try and host a formal Q&A as well. So without further ado, just about our two speakers. So Dr. Marina Romanello is the Executive Director of the Lancet Countdown and a climate change and health researcher at UCL. She trained as a clinical biochemist in Argentina at the University of Buenos Aires and holds a PhD from Cambridge University in biomedical sciences. She currently works as an NHS consultant and has led a team of researchers in developing its net zero commitments, and is a member of the working group on health co-benefits in climate change mitigation policies of Italy's Superior Health Council. Professor Costello, he is a past director of maternal, child and adolescent health at the World Health Organization. He is currently a UCL professor in global health and sustainable development. He chaired the 2009 Lancet Commission on managing the health effects of climate change, was chair of a new Lancet Commission which links the UK, China, Norway on emergency actions to tackle the climate health crisis, and he is currently the co-chair of the International Lancet Countdown for Climate Health and Action, and is a senior advisor to the Children in All Policies 2030 or CAP 2030 program, which is supported by the World Health Organization, UNICEF and the Lancet. He is also the author of The Social Edge, which looks at the power of sympathy groups for our health, wealth and sustainable future. So without further ado, let me just share Prof. Romanello's video. Perfect. Thank you very much to Dr. Romanello in her absence. I will hand over to Professor Costello, who will follow up with the second presentation, and then we can answer some of the questions that have been coming through on the chat after that's all done, if that's all right. So, Prof. Costello, when you're ready. Thank you.
Thanks very much, Srinivasa and Delan, and it's a great privilege to be here. I realised this morning that it's 36 years since I joined ICHG, and there have been many great meetings, actually, and I'm really pleased to see it's in good health and very much expanded since the days that I joined. And huge thanks to Marina, who's our brilliant executive director. She really is a whirlwind, and she's on her way back from COP. And I think Delan must have met up with her when she was there. I'm just going to say a few words on my... I think, are you going to put the slides up for me? Or do I have to click on that? Whoops. Do I have to do that? I thought they had them.
I think if you are able to, that would be fine. Otherwise, I can ask our team to do it.
Okay, no, it's all right. I'll share screen.
Thank you.
Select window. There we go. Whoops. Are they there? No. Oh, God. Sorry about this. I thought they had them back. Let's try again. ICHG. Allow.
It all worked perfectly before.
Yeah.
There
we go. Okay. Sorry about that. I'll speed up. So when I was, this was about 5-6 years ago when I was at WHO, we set up another commission to think about the future of the world's children. And we were incredibly lucky to get former Prime Minister Helen Clark from New Zealand and Awa Costello, who's a pediatrician and also Minister of State in Senegal. And they were the co-chairs, and we have 41 commissioners from around the world. If you haven't seen this, it was published in 2020, and you can download it for free from the Lancet. And essentially what it said was, look, children are not, obviously diarrhea, malaria, pneumonia, etc., are very important, but we need to protect children from every sector. So if you look at, the commonest cause of death over the age of 5 is road traffic accidents. So it's about transport. We need very strong agricultural and trade policies if we're going to protect children from malnutrition, both over and under. Play areas and urban planning. Environment. I mean, the latest WHO figures show that 99% of all children in the world breathe unsafe air, which is staggering. And the long-term effects of that will be considerable. And then we've got family services. Helen Clark was very strong on the housing issue because the figures are that 40% of children in the world live in informal settlements with all of those associated hazards. And education, yes, education has expanded across the world, but the quality of education is often leaves a great deal to be desired. And obviously girls are often excluded or leaving school much earlier than others. So these are all big issues. But after the report, we didn't just want to publish a report, and we spent about 18 months trying to get some money together, and we set up something called Children in All Policies 2030. This is with WHO, UNICEF. The secretariat is at UCL, actually in the same office as the Lancet Climate Countdown. And the idea was to see if we could work through countries, with countries, to see if they could implement some of the key elements of what we said in that report. And I'll just touch on 3. The first is that women and children need to be at the center of climate change and SDGs, that we need to get that message across to governments. Awa Costello said in Senegal, she'd spent 10 years trying to persuade the cabinet that they must focus on child development, because that's what successful countries did to bring about change and economic growth. And she thought she was getting somewhere finally in Senegal. But the cost of inaction is great, and there is a big financing gap, which has probably grown since that slide has been shown. The second, which sounds boring, is multi-sectoral action. And we often say, oh, we've got to get ministries to work together. That's the worst layer because they're competitive. What you really want is to get this into cabinet where they're all sitting around the same table, or down at state or district level, or best at community level, because they're much more used there to working across sectors. And of course, we need to also have an approach whereby women and children actually have a voice and can contribute to the debates about what is essential for their current and future well-being. And that doesn't happen in many places. And then a third thing is that we need to act on climate now. I've only been to one COP, which was last year in Glasgow, and I took this picture a girl, you know, being carried by her father in the street. And obviously it's a number one priority, and we need collective action. And all of us have a duty really to leave the world in a better place than we found it. And I'm afraid my generation has certainly failed in that regard. One thing we did in the report was to emphasize not just whether children were flourishing now, but what was going to happen in future, as estimated by whether or not our countries were exceeding the Paris commitment to carbon dioxide emissions by 2030. And you can see that the poorer countries like the Central African Republic and many others are not doing so well on the Child Flourishing Index, but they're doing much better. They are sustainable in terms of CO2, whereas all the wealthy countries like our own are not. So we're all in this together, and in many ways, the wealthy countries are the bigger problem. One thing we've done in the last year, last 18 months since we set up, was to work closely with WHO and UNICEF, which is actually used to be a real problem when I was there, but now is much, much easier. And we got two great people in UNICEF and WHO leading on this. And there's a visually, you know, policymakers have a attention span of about 2 minutes. So we wanted to traffic light score all the child health indicators. You only see some of them there, for a country, so that a country could look across it and see whether they were red, yellow, or green, and whether there's grey dots there where you can't actually have any data, as a way of kind of stimulating action. And at the moment, we're working particularly, or about to work, in 3 countries, in India, South Africa, and Ghana, to explore ways in which, working with policymakers and academics and others, whether this could focus some more multi-sectoral approaches to protecting children. And we could talk about that during the discussion if that comes up. I just want to finish with one example, which I think is really interesting. My colleague, Dr. Naomi Saville, who has presented before to ICHG, has been running a pilot over the last year where she works with young people and children in schools using citizen science methods to try and think about ways to improve climate resilience. Now, in Nepal, landslides in the Middle Hills are a massive issue because of the intensity of monsoon rains and the like. And working with children using handhelds and apps like iNaturalist, and apps that they made themselves actually to monitor and measure hazards and pests and the like, the kids absolutely loved it, as did the teachers, actually. And we shouldn't forget that a lot of teachers in remote areas get quite demoralized by lack of support. So they all love doing this. And this is just one example. There is a paper coming out in the Wellcome Trust open research issue in the next couple of weeks. And this is an example of hazard mapping that they did, these children, in 2 areas, Kavre district, which is Middle Hill district, where they identified 13 hazards, and in Jumla, a high mountain remote area, where they identified 59 hazards. So you can see there crop pests, landslides, mustard crops, potato crops, and agricultural land ruined by flash flooding. And this is really, you know, important, because the next step is what we would love to do is a large-scale rollout of this, whereby this information is fed into community groups, community leaders, women's groups, teachers, and the like, and then they go through a participatory learning and action cycle to think about ways in their own environment how they could build resilience and protect things. And one of the reasons that this is exciting, if we could show and demonstrate that it improves not only child nutrition and health, but also land health, is this, that nowadays you can use satellites down to a pixel area of about 10 square meters to measure crop performance in terms of green cover and also intensity of green cover, water content of soil, but also excitingly soil carbon. In the past, we've had to always do that simply by expensive tests. Now you can do it a combination of tests and satellite algorithms. And the beauty of that is that if you can show that such interventions could trap carbon in the soil, you've got a totally sustainable system, because every bank and finance house in the world is anxious to find ways to trap carbon, and they would fund this and invest in it. So that's something we want to do, and I hope that Dr. Saville will be successful in her Wellcome Trust senior fellowship bid, and that we can get money to do that. I'll just finish by saying we've had a lot of experience in looking at participation and groups, and it does work not just in research studies, but at scale. Recently, my colleagues in India showed they had scaled up something to nearly 40 million people in Jharkhand, the whole state. And they showed in an evaluation of 1 million of those people where they had this intervention, a 24% reduction in neonatal mortality when the intervention was implemented compared to when it hadn't been. So I think this is an important thing. I'm going to stop there and let's have some questions. Thank you.
Thank you very much, Anthony. And lots of things came to mind through your talks and Marina's, and it's reflecting on the air pollution. I mean, as you know very well, the south of Nepal was measuring air pollution levels, and it was so incredibly high. These children were breathing in 6 times the WHO limits as a normal. I mean, and when they got a bit older, the girls would start doing cooking, and those levels would reach thousands of times higher. It was interesting yesterday, and it was the gender theme day at COP, and the WHO were talking about air pollution and gender and its effects on women and children. And that was a big focus yesterday. So some of these things are reaching the agenda, but still, I'd say WHO is pretty peripheral to these discussions. We have a few questions on the fossil fuel industry, but I want to start just with a general question about what can people attending the conference do? So ICHG members are mostly child health professionals. I mean, there will be a broader group of people attending today, but are there tangible things that people can do to support?
Yeah, that's a really good question. There's lots of things that people can do. Just to say, to start with, we need governments to act, we need institutions and business to act, and we need individuals to act. And so we can all contribute to this. And, I remember saying to a philosopher once, what can an individual do? And the philosopher said, actually, that's all you can do, is what individuals. So the list is talk about climate change repeatedly in every forum, switch to a plant-based diet or a largely plant-based diet. I ate, you guys have Indian heritage. I ate a Nepali diet for a few years, and it's the best diet in the world, and it's incredibly sustainable and healthy. Switch to renewable energy, and one has to invest to do that. I think, I've been slow to do the solar and all the rest of it. Reduce, reuse and recycle, more active transport, walk and cycle more. You don't need a car in London. You really don't, because the transport's so great. But, in other places that's more difficult. If you have to use cars, try and use electric or hybrid, or just rent one, and not rent one, do a car share scheme. Stop flying as much as possible. I tend to travel to Europe now wherever I go, if I go, not so much by train. Divest from fossil fuels or campaign for it. Set up a green company, protest and vote. Now, that doesn't sound that we're going to change the world, but if everyone starts doing this and building momentum, pressure on politicians comes from below. And we're up against resistance. You mentioned fossil fuel representation at COP. I believe they've got bigger delegation there than any nation state. And that's outrageous.
I can say that. The biggest lobby group at COP is the fossil fuel industry. Just picking up on that point, we have a couple of questions around fossil fuels. Rosa Spooner, financing fossil fuels is directly impacting child health. The Fossil Fuel Non-Proliferation Treaty may provide a way of limiting supply of fossil fuels. And then Katie Rose, what does the answer to the fossil fuel addiction lie? Where does the answer to the fossil fuel addiction lie? Could it be controversially within these awful energy companies, or is enough being done elsewhere to leave these companies behind? Do you have
Well,
any
on the
thoughts
first,
on what we can do?
yeah, on the first point on the non-proliferation treaty, when I was in Glasgow last year, I met the people, I think they were Australian, who were leading on this. And I thought, that sounds a great idea, but will it take off? And I think it really has taken off in the last year. And you may have more information about that, Dylan. But I think that's a really important thing as a campaign that everyone can get behind. On the fossil fuel business, I mean, renewables are now cost equivalent or cheaper than fossil fuels. And so I think there will be a big investment drive from business now to try and hopefully that will go exponential. But the fossil fuel industry is gearing up. You know, they've made billions, hundreds of billions of profit in the last year, which is outrageous that we're not taxing this much more than we should do. And they're going to still try and drill and all the rest of it. And of course, they've got a lot of support. I mean, I was appalled to find that, you know, our mainstream media are being bombarded by comments and stuff by people who are heavily conflicted, from like the Global Warming Foundation, who get fossil fuel support. There was a big article on by Bjorn Lomborg, who's a climate skeptic for years, selling his book, basically, published in the Times last week. And we wrote back a long piece, and they eventually compressed it to 150 words as a letter. And you know, this is the problem, that a lot of people in the mainstream media are being funded by fossil fuel interests. And we have to resist that in various ways, because we're running out of time. I mean, we're going to exceed 1.5 degrees within the next decade, at least. And you know, the future for our children is really grim. Things are happening much faster than we expected back in 2009. And, you know, potentially this is an existential threat if we don't really get our act together.
Yeah. And one of the things we've been talking about here is that it doesn't affect all children equally. It's certain children who are affected, the poorest children. The poorest children in London, you know, one of the richest cities in the world, these are the children who are affected much more than others. And the poorest parts of the world, from flooding, from air pollution, from everything we've discussed. Can I follow on with another question from Rosie Spoon, just linking into the policymakers aspect? How do you think the Lancet Commission helps inform health policymakers in terms of health system adaptation? Yeah,
that's a very good question. Very quickly, because we've only got a few minutes left. We've had a certain amount of funding to run this over the past 5 years, and under Marina's leadership and also Nick Watts previously, we've expanded hugely. Given the, you know, our budget from the Wellcome Trust is about $1 million a year, and yet we've got a secretariat now of about 6 or 7 people, but we've set up regional groupings around the world with like more than 500 academics. So there's about 70 or 80 in Latin America. We have a network in Europe, in China, in Australia. We're starting one in Africa. We hope to move to South Asia in the next year or so. And also we have strong links with a big group in the United States. So it's reaching global coverage. And in the next phase, we're currently being evaluated by the Wellcome Trust, and we want to get obviously more funding in, mainly to put out to regions and to develop some of the practical research stuff that enables us to work with policymakers. That's why I showed you the kind of children in all policies type stuff, where you actually, you know, don't just do trials that publish in Nature in 5 years' time, but actually get involved in implementation science, if you like, working with policy people. And particularly, you know, doctors actually have a bigger voice in many lower middle income countries with policy, because they're influential, than us, you know, derided group over here. But so I think all of those things are important. I think we could do much more. And certainly a lot of ICHG people should keep in touch with Marina, definitely, so that if new opportunities arise. Oh, the other thing is working with WHO. WHO is always the football. Everyone kicks them and moans about them in every crisis, whether it's Ebola or the pandemic. But of course, no one funds them. You know, all their money is diverted away into the Global Fund or all these things run by bankers. But but we can work with them. And Dermot Campbell-Lendrum, who's the head of climate change at WHO, has been on our board for the last 10 years or however long it's been, 6 years. And so I think there are things that we could do and help with, people like yourselves getting involved in links into training and helping lower income countries with their data collection and adaptation.
Wonderful, thank you. I met him yesterday, actually. Sri, do we have time for another question, or do we need to round up?
I think we have time for one further question, if that's all right. Yeah. And then after that, if everybody could leave the stage and go into sessions, then your workshop should be prepared for you to go into straight away. So one more question, if that's all right. Thank you.
Can I just pick one question from Sarah Frost? So this is regarding citizen science. And there are a few questions here, but this is about how does mapping hazards translate to solutions? And I suppose it's the responsibility that is placed on children without support and resource. How do we manage this kind of process to help children and young people, but without placing the burden on them when it really shouldn't be on young people to find the solutions?
Well, in terms of participatory learning and action, it wouldn't be the children themselves necessarily doing this. So what they've found would then feed into a process. When we started our PLA women's group trials 20 years ago, everyone said to us, chatting, you're not going to change things by just chatting. And yet we did show big impacts on newborn mortality and then later on diabetes and pre-diabetes in Bangladesh. And so galvanizing people for their local initiative, because they know their own locality, does have impact. So we need to demonstrate this, and that's why we want to do stuff not just in small few villages here and there, but a big large scale thing. But I think the children being part of it will provide energy and impetus, but it will require engagement with more the decision makers in communities. I'm fairly optimistic about that, but obviously we need to demonstrate it. But if we could show that we're also improving agriculture and trapping carbon in soils, then that would be a big bonus. I just hope we're at a tipping point of political persuasion. I think 10 years ago, most people they saw this about polar bears and warmer weekends. Now, I think most people are realizing how serious this is because it's affecting every region in the world. So Sarah's right to be skeptical, and we should all be skeptical as scientists. But I think citizen science could play an important role in the way that it has done to boost, for example, bird populations in the UK.
Brilliant. Thank you very much, Anthony. That was wonderful. And thank you to Marina before that. Maybe I can just leave with a comment from Amaran Kumarasamy in the chat, who talks about the politics of this. And, I would encourage people to get involved with the advocacy group within the ICSG. And the thing I keep on banging on about is lowering the voting age and allowing children to vote and have a say on these issues. But there are lots of things people can do that Anthony has described in detail in terms of encouraging, advocating to your politicians, wherever that may be. And some of the centers of power have the most influence around the world. So there are things you can do locally that affects people everywhere. So thank you very much, Anthony. And Sri, back to you.
Thank you very much. Thank you, Prof. Costello and Prof. Devakumar, and Dr. Romanello. If we haven't answered your question, then we will try and answer them after the session. For now, we'll stop broadcasting. If you can leave the stage and go to the sessions, which is the icon below the stage, then you should have a link to your group workshop already made. So thank you very much for coming to our welcoming session. We hope it was informative, and we'll see you at the next one. Thanks again.